Hello, good day to each and every one of you. Thank you very much for showing interest in our webinar entitled Moxibustion. So this special webinar is made possible through the cooperation of Philippine Academy of Acupuncture Incorporation or PAAI together with LAMP AcuWellness Foundation Incorporation. So on behalf of PAAI and on behalf of LAMP AcuWellness Foundation, I would like to welcome each and every one of you for your time. Thank you for showing interest with our topic for today of Moxibustion. Okay, with that being said, let us now begin with our webinar. So, so today this is our current status. As you attend more and more webinars, I hope you tend to expand your horizons, meaning the more you learn, the more you see. So your continuous consistency in attending our webinars would help you to understand and have a deeper understanding specifically about the practice of moxibustion. So let's begin, no? Our educational objectives for the day would be to define moxibustion, discuss the functions and classifications of moxibustion, illustrate the application of moxa in the treatment of different TCM cases, illustrate moxibustion methods in different ways, and last but not the least, will be to present evidence-based medicine with regards to TCM moxibustion treatment for various clinical diseases. So for the introduction, here in the ancient manuscripts of the Chinese, in one of their historical textbooks, comes this picture wherein you can see the patient with his back turned on the practitioner, and the practitioner, as you can see, is igniting a certain material on the patient's back. No? So this is generally the process of moxibustion. And moxibustion plays an important role in the traditional medical systems of China, Japan, Korea, Vietnam, Tibet, and Mongolia. So moxa has a very important role in terms of physical health as well as wellness practice in Asia. And in the TCM Pearls of the Inner Classic of the Yellow Emperor, Basic Questions, specifically in Chapter 12, it is said there that the North is an area where the heaven and the earth are hiding their vital energy as the weather is icy cold. People in the north live on the highland, drink the milk of cow and sheep, and move from place to place. When their viscera are cold, diseases of distension often attacks the people. Moxibustion therapy is a proper treatment. So moxibustion therapy spread to the country from the north. So moxa originated from the north because the north is an area where it is dominated by cold weather. So one way to treat the symptoms and diseases arising because of cold weather, so the Chinese developed the treatment of moxibustion. And did you know that in chapter 73 of Miraculous Pivot, it states there that a disease that may not be treated by acupuncture may be treated by moxibustion. And in Introduction to Medicine, it says, when a disease fails to respond to medication and acupuncture, moxibustion is suggested. So these are recorded in the ancient classics. So basically, what it tells us is that if you know how to do moxa, it can be a good supplementary and even alternative treatment for acupuncture. Because as you know, not all cases are being able to treat by acupuncture. So you might want to explore the practice of moxibustion. So if you know both acupuncture and moxibustion, then your TCM practice, specifically your clinical practice, would definitely flourish and be more enhanced in terms of treating different clinical cases. Okay? So in the next slide, we have different versions of moxa. Here on the first picture, we have a moxa stick. suspending Moxa Stick held over the back shoe points of the patient. We also have direct Moxa using Moxa wools. We have the combination of acupuncture and moxibustion simultaneously, known as warming needling. And on the last picture here is a Moxibustion stick using an apparatus, specifically a Moxibustion box. So we will tackle them one by one later, but first let us define Moxibustion. So Moxibustion, this is a traditional Chinese medicine therapy which consists of burning dried mugwort on particular points on the body. It is a TCM technique that involves the burning of mugwort, which is a small spongy herb to facilitate healing. Mugwort, in its scientific name, is known as Artemisia vulgaris, a species of chrysanthemum. Moxa, produced from the province of Sichuan, is known as the best kind for moxa as the climate and soil are good for its growth. And here's an example of our moxibustion plant. This is our wormwood or mugwort. In Filipino, we call it damong maria or hilbas. No? So you can see they have round, pointed leaves, pointy leaves. No? So usually they harvest it, then they dried it, and then when they make it to the process of drying, they roll it into a stick, and then that stick is the one that we are going to use, which is known as our current moxibustion stick. So, a little details about plant excerpts, no? So, in a new edition of Materia Medica came the description for Artemisia vulgaris. So, the moxa leaf is bitter and acrid, producing warmth when used in small amount and strong heat when used in large amount. It is of pure yang nature and having the ability to restore the primary yang from collapse. Then it can also open the 12 regular meridians traveling through the 3 yin meridians to regulate your qi and blood, expel cold and dampness, warm the uterus, stop bleeding, warm the spleen and stomach to remove the stagnation, regulate menstruation, and ease the fetus. So, your moxibustion can also regulate your qi and blood with the property of warm and yang in nature. So this is a very good partner together with acupuncture. And then it also states, no, when burned, it penetrates all the meridians, eliminating hundreds of diseases. Yang Qi can be activated by the Artemisia leaf for its warm nature. And then furthermore, it states that the acrid odor of the leaf can travel through the meridians, regulate qi and blood, and expel cold from the meridians, and its bitter nature resolves dampness. So moxibustion, aside from being used for cold, cold pathogens, you can also use it for damp pathogens as well. So cold and damp. Okay, so moving onwards, we are now going to discuss about moxibustion and its functions. So generally, moxibustion has 4 functions. So we will go over them one by one. So first up is that it warms the meridians and expel cold. So the abnormal flow of qi and blood usually result from cold and heat. So when you have cold pathogens attacking, it will cause slow flow or stagnation of your qi or your vital energy. And then for heat pathogens, it will cause rapid flow of qi or rapid flow of vital energy. Treating diseases caused by cold dampness and persistent diseases caused by pathogenic cold penetrating into the deep muscles. So chapter 75 of your miraculous pivot or your Ling Shu, it states that if stagnations of blood in the vessels cannot be treated by warming up with moxibustion, it cannot be treated by acupuncture. So generally, you need to use combination treatment. So aside from acu and moxa, you have to use TCM herbs, gua sha, cupping, and other modalities as well. And it also states that in chapter 48 of the Miraculous Pivot, depressed symptoms should be treated by moxibustion alone because depression is due to blood stagnation caused by cold, which should be dispersed by moxibustion. Second function, to induce the smooth flow of qi and blood. So in chapter 64 of your Miraculous Pivot pointed out, when there is an excess of qi in the upper portion, the qi should be brought downward by needling the points in the lower portion. So this is basically not only applicable to acupuncture, but it also applies to moxibustion. So moxibustion to induce qi and blood to flow upward or downward. An example would be kidney 1. So when you do a kidney 1 moxa, it's for liver yang syndrome or due to the upward flow of yang qi so as to lead the qi and blood to go downward. So before, when a patient suffers from high blood pressure or headache because of too much stress, your hyperactivity of liver yang, the ancient Chinese used to do moxibustion at kidney 1 so as to help lower their BP. Okay? Another example, do 20 or your governor vessel 20 moxibustion for anal prolapse, uterine prolapse, and prolonged diarrhea due to sinking of qi and excess in the lower portion of the body so as to lead yang qi to flow upward. So, when you have this kind of disease, your prolapse and your prolonged diarrhea, moxibustion at the top of the head, the vertex of the head, your do 20, can help with that symptoms by leading yang qi to flow upward. So these are classic examples of how moxa induced the smooth flow of qi and blood. Number three, it's to strengthen the yang from collapse, no? Because as we know, yang qi is the foundation of the human body. When it is sufficient, you will have long life. When it is lost, you would suffer death. So moxibustion applied can reinforce yang qi and prevent collapse. So one way to strengthen your yang qi is doing moxa. The others will be Tai Chi, Qigong, acupuncture, TCM herbs, and so on and so forth. So you just have to choose which treatment modality you are most comfortable with and you are most apt with. Okay? So chapter 73 also states that deficiency of both yin and yang should be treated by moxibustion. So both yin and yang deficiency can be treated by moxibustion. Actually, not only deficiency, but even the excess syndromes, no? But it has more application on deficiency cases of both yin and yang. Last but not the least is to prevent diseases and keep healthy. So in the prescriptions appear the following description. Anyone who travels in the southwest part of China, such as Yunnan and Sichuan provinces, should have moxibustion at 2 or 3 points to prevent sores or boils and to avoid pernicious malaria, epidemic diseases, and pestilence. Then it also states if one wants to be healthy, one should often have moxibustion over the point stomach 36 or your Susan Lee. So I remember before my masters were telling me that people in the provincial China, the far-flung provinces, they would only know 1 point, and that 1 point is stomach 36. So they either do acupressure there every day, acupuncture. Some people tend to practice moxibustion. So moxibustion is very apt, especially for strengthening immunity at the point stomach 36 or your Susan Lee. Other points that you can use states there in the notes on Bienche's moxibustion. It says that when a healthy man often has moxibustion to the points of CB4, CV6, CB4, CV6, GB4, and CV12, he would live a very long life, at least 100 years of life. So if you notice, all these points can be found on the trunk, no? Three of them can be found anteriorly at the belly area on your abdomen and one at the back because this area has always been attributed as the turtle. The turtle, as you know, symbolizes long life. So when you apply that, specifically in your abdominal acupuncture paradigm, you would see that the turtle is placed on the abdomen with the navel at the center or your belly button. So points in this turtle or your run meridian, specifically your CV6, CV4, and CV12 can help prevent diseases and keep healthy. So I made a tabulation of chart called the energy acupuncture points. Here you can see that the CV meridian or your conception vessel or your run meridian, specifically your run 17, run 6, and run 4 are all tonifying points. So I made this tabulation for your reference, but usually moxibustion generally is applied to run 6 or your CV6 or your C of chi point and your run 4, your gate of origin point. So they are used to strengthen your yuan qi or your primary qi. So you can have this chart for your reference. Okay? So moving forward, let's now discuss moxibustion and its different preparations. So the materials for moxa, you will need a moxa wool, a moxa cone, a moxa stick, matches, lighter, and a tray. So you would have to be prepared when you're going to do moxa. So let's first take a look at moxa cones, no? So making of moxa cones, you place a small amount of moxa wool on a board, knead and shape it into a cone with the thumb, index, and middle fingers. So you have three sizes. Generally, in the classic description, the smallest is described as a grain of a wheat, the medium, half a date stone, and the largest moxa cone would be approximately the size of the upper part of the thumb. But in a more modern description, the small moxa cone is 2 to 5 millimeters in diameter and 4 to 8 millimeters high, and with the largest roughly 11 to 15 millimeters in diameter and 14 to 25 millimeters high. So that's roughly around 1 to 2 centimeters. No? So this is the modern or Western way of measuring the moxa cones. So your smallest and medium sizes are used for direct moxa, and for your largest moxa cones, they are usually used for indirect moxibustion. Later, we'll discuss them more. So for the making of the moxa cones, now, as you can see, it's 1 centimeter high and 0.8 centimeter in diameter. So you will need that and shape it into a cone, then place it on a specific acupoint and ignite it either with a lighter or an incense, no? And then from there, you can either do a direct moxa with either scarring or non-scarring moxa. So once the patient feels heat at the acupoint, you can remove the moxa wool and replace it with another one. Okay, so this is your moxa cones. For the moxa stick, this one is more convenient. More longer, diameter of 1.5 centimeters, but it's roughly approximately 20 centimeter in length. So you simply roll moxa wool or including other herbal medicine can be mixed into the shape of a cigar using paper made of mulberry bark. So this is what it looks like. A moxa stick together with your moxa wool. Some of them have herbal ingredients as well. So then you can use that stick as an indirect moxa. So to ignite and even put warmth on specific acupuncture points, no? So, moxibustion, you classify it in terms of techniques, no? So we have the moxa cones, moxa sticks, and warming needle. For the moxa cones, you have direct and indirect moxa. For direct, you have scarring and non-scarring moxibustion. For indirect moxa, you have the ginger insulation, garlic insulation, salt insulation, and your monk should cake insulation. So here is a more visual view of how these different techniques were done. So you can see direct moxa has contact with the skin. Indirect moxa, you don't have contact with the skin. It's either you suspend it away from the skin or you're using a medium. No? And then we also have the warming needling, the acupuncture plus moxibustion simultaneously. So let's discuss first your direct moxa. Direct moxa, moxa cone placed directly on a point and ignited, also known as your open moxibustion. This one is used in ancient times with better results. So it's divided into two, scarring and non-scarring. So let's discuss them later, no? Direct moxa, this is what the picture of a direct moxa looks like. So here, the practitioner molded the wool into a cone triangular shape and apply it to Li4. Then you can also mold a cone, a small cone such as this to be applied on your distal points or specific acupuncture points. For scarring moxa, no? Under direct moxibustion, you have the so-called scarring moxa. Although nowadays, this is now rarely practiced, but the ancient physicians tend to practice this kind of moxibustion. It's also known as festering moxibustion. So before they do that, they apply onion or garlic juice to the site, in order to increase the adhesion of the moxa cone to the skin. Then put the moxa cone on the point and ignite it until it completely burns out. Then you repeat the procedure for 5 to 10 units. It may lead to a local burn, blister, festering, and scar after healing. Indications are chronic diseases such as your asthma. So an example of your scarring moxa here. So you can see roughly at the level of the umbilicus here, 1.5 soon below it is your CV6. As you can see, there's a scar there. So this person has practiced no scarring moxibustion at this area. So you would let it totally burn and you would induce a scar or an injury or even a blister for it. So this is what the ancient Chinese physicians were doing during those times. So here is a video of moxibustion, scarring moxa, no? So as you can see, this practitioner is performing scarring moxa, no? Not only at the back shoe points, but also at LI11 and bladder 13 for your back shoe point of the lung, no? See? You will totally let the moxa wool or cones burn out, and then that would induce a response, systemic response actually. So this practitioner used bladder 13 and bladder 43 for this patient. No, it's expected to have normal redness at the areas where you do your scarring moxibustion. No, so you will tell the patient that it would burn and it would sting and it would hurt because you're doing a scarring moxibustion. Okay. Mm, okay. So moving on, let's see. So she just repeat, no? Okay. And then moving on, you have your scarring moxa. Some patients would have ulcers or injuries. Others would have blister, no? When you do your scarring moxa. So this is what you want when you do this. So people are asking me, Doc, how come they practice this kind of method? If I remember correctly, did you know that the blister fluid of one from a scarring moxa versus one from a burn injury are very different? Did you know that when they do a proteomic fluid analysis of the blister fluid due to scarring moxa, they were not able to find any pathogens in the fluid, meaning it is sterile. Whereas for a burn injury with blisters, when you do a proteomic fluid analysis, you would see myriads of pathogenic bacteria there. So it is non-sterile. So basically, one of the secrets that lie with the scarring moxa is that when you do a suppurative scarring moxa or one with the blister fluid, that's the one way of how your body heals. It's either through detoxification and activation of your systemic inflammatory responses inside the body so as to bring about good health and effective results. So a very interesting finding of modern research applied to ancient practice of scarring moxa. But however, this is now rarely practiced nowadays. No, most people will practice this one, non-scarring moxa. So the non-scarring moxa is a moxa cone placed on an acupoint and ignited. When half or two-thirds of it is burnt, or the patient feels a burning discomfort, remove the cone and place another one. Should be no blisters, festering, and scar formation. So once the patient feels enough heat, remove it. No? So the indications are diseases of chronic, deficient, and cold nature, such as your asthma, chronic diarrhea, indigestion, etc. So here is a clip of non-scarring moxibustion applied at bladder 67. So non-scarring moxa applied at bladder 67. See, ignite it, and then you are already getting ready to remove the moxa cone. Once the patient feels warm or hot, remove the moxa cone and then apply another one and then repeat the procedure for several units, roughly between 5 to 10 units of moxa cone. So this is non-scarring moxa. You do not let the whole moxa burn out totally. Okay? Did you know that when you're doing direct moxa before they have a Chinese poem, no? And it's written such as this, but don't worry, I translated it for you. They use have a formula rhyme that says that support moxibustion. Moxibustion takes patience and skill. Lit moxa hits the skin and the heat might hurt at first, but you relax as the days goes on and you spend less as it gets simpler, more convenient and effective. If you do moxibustion at your own home, the fragrance of the moxa refreshes the soul and expels wind, cold, moisture, and disease. No? So this is a formula rhyme for direct moxibustion in Chinese, but now we translate it to English. Okay. Next up, we have indirect moxa. So indirect moxa is an ignited moxa cone, does not rest on the skin directly, but is insulated from the skin by one of four types of materials. Can be ginger, garlic, salt, or mongshu cake. So, moxibustion with ginger. Technically, you slice a ginger roughly 0.5 centimeters thick, punch numerous holes in it, and place it on the point selected. On top of this ginger, a large moxa cone is placed and ignited. When patient feels it scorching, remove it and light another. So, this one is indicated in symptoms caused by weakness of your stomach and spleen, specifically if they're been invaded by cold or when you have spleen deficiency, which is very common nowadays. No? So they tend to have symptoms such as diarrhea, abdominal pain, painful joints, and symptoms due to yang deficiency. So before you do your moxibustion there, make sure to puncture the ginger with a acupuncture needle so as the heat penetration of the moxibustion is more effective. So now here is an actual video together of me and my roommate when we did moxibustion with ginger. So before we begin, I applied some water there to soak the area so as for protection. And then here is our slice of ginger punctured adequately with a moxa cone placed on top of the ginger. And then we will ignite it because he was suffering from abdominal cramps recently and diarrhea. So this patient is extremely afraid of cold. So we decided to do a moxibustion indirect moxa with ginger as our medium. So you have to ignite it, and then when you ignite it, burn it, let it burn. And then once the patient feels heat or it's becoming the heat becomes very unbearable, then you would replace and remove your moxa wools as needed. So this is an example of moxibustion, indirect moxibustion using the ginger as a medium because ginger is warm in nature and moxibustion is also warm in nature. So you are applying both the herbal properties of your moxa and your ginger to help with specific problems such as yang deficiency. Okay? So moving forward, another that you can use is garlic, no? Same, 0.5 centimeters thick. Then you place a moxa as well. So garlic is also warm or hot in nature. So it's indicated in scrofula, tuberculosis, early stage of skin ulcer with boils, poisonous insect bite, etc., etc. So, here's a picture of your indirect moxa with garlic. Same, you tend to place your garlic slices where you want to put your moxibustion, specifically at your acupoints or your back shoe points, and then place your moxa cones on top of the garlic and ignite them accordingly. Then once the patient feels hot or warm, or once your moxa wool has burnt out totally, then replace them as needed on how many units you want or you deem necessary to do for the clinical case of the patient. So repeat as warranted. Okay? Another, you can also use salt, which is applied at the belly button or your umbilicus. So you fill the umbilicus with salt to the level of the skin. Place a large moxa cone on top and then ignite it, renew the cone when the patient feels it scorching. So, this one is effective for abdominal pain, vomiting, diarrhea, pain around the umbilicus, pain caused by hernia, prolonged dysentery, etc. It has the function to restore yang from collapse, excessive sweating, cold limbs, and undetectable pulse. Large moxa cones may be used successively until sweating stops. pulse restores, and your four extremities get warm. So a picture of the Moxibustion with salt in it, but I have something better, which is a video. So this is an actual video of mine when I was a student in China. So this patient suffers from neurogenic bladder, actually. So they tend to use salt, Moxibustion with salt at the umbilicus because they believe salt, as you know, is the property of the kidney. So when you're doing moxa together with salt, the property of the salt tends to strengthen or tonify the kidney so as to help the patient with their respective problems such as difficulty urination or urinary problems. So as you can see, after the moxa cone was totally almost burnt down, roughly three-fourths, and the patient feels warm, you would replace it with another moxa cone, a large moxa cone, then ignite it accordingly. So this lady used a incense to ignite the moxa cone, and then you repeat the procedure as needed and replace the moxa cone once the patient feels again the heat from moxibustion. Okay? So next, indirect moxibustion with mongshood cake, also known as your aconitum or aconite, or in layman's term, we call it wolf's bane. In Chinese, they used to call this fuzi. So this is a TCM Chinese ingredient, no? So it is mixed with alcohol, punched with numerous holes in it, and placed on the site for moxa with the moxa cone ignited and burnt on top of it. So it is of heat nature, it warms yang and expel cold. Because your mongshood cake is of warm nature and very hot, no? So you use that for cases of yang deficiency and cold cases, no? So suitable to treat deficient and persistent yin cold syndromes such as impotence and premature ejaculation caused by declination of your Mingmen or your vital gate. Mingmen, as you know, is your GV4 or your governor vessel 4. It's located at the back, no? Specifically below L2's venous process, no? So this is your monkshood cake, a picture of it. So you apply it with the moxa cone on top of it, and you use both the herbal property of the ingredient and your moxibustion so as to reinforce the yang of the patient. For moxibustion stick, you apply a lighted moxa stick over the selected point. It's easy to control heat and time during moxibustion, and the therapeutic effect is good. It's divided into three: mild warm moxa, sparrow pecking moxa, and warming needling. So the moxa stick was developed in the Ming Dynasty, no? This one I tend to use a lot in my practice, personal practice, because it's very convenient, very safe, easy to perform. Moxa stick is lit at one end and held about 1 inch from the skin and burned for up to 15 minutes or until the skin around the area is bright red. So you can use it at the back, painful areas at the back, the neck, even your yin tang point at the face, neck problems, stomach 36, or wherever, whatever the problem area is. So Moxa stick is more convenient, more easily performed, and you can also instruct the patient himself or herself to do it. You can also do it by asking your assistant or your professional therapist, or you can instruct it as home care for the patient. No? So let's discuss first your mild warm moxa. So you apply an ignited moxa stick over the point to bring a mild warmth to the local area for 5 to 10 minutes until the local area is red, or once the patient feels very hot at that area or your acupoint is adequately stimulated by the heat. So here's an example of my classmate doing a moxibustion at stomach 36. So he feels one stick is not enough. So he decided to do two sticks instead for stomach 36 because he wants to have a more reinforcing action of moxibustion. And then another classmate of mine saw him and she decided to do a bundle of Moxa sticks, roughly 7 Moxa sticks, all bundled together like a dynamite because she is suffering from knee pain that is aggravated by cold and dampness. So she decided to do multiple Moxa sticks at one area. And she said it felt really good when you're doing the mild warm moxa or suspending moxa at the acupoint. So you do not touch the area or the skin per se. Otherwise, you would cause a burn injury or you are doing a scarring moxa. But for indirect moxa with the moxa stick, that is your example of your mild warm moxibustion. Another technique is your so-called sparrow pecking moxibustion. So for sparrow pecking moxibustion, an ignited moxa stick is rapidly pecked over the point, paying attention not to burn the skin. Ignited moxa stick may be evenly moved from left to right or in circular movement. And then your sparrow pecking looks like this on a picture, but my classmate demonstrated it to me with a video. So sparrow pecking, slow like a sparrow pecking on a tree. So sparrow pecking on an acupuncture point. No? Then, last but not the least would be your moxibustion with warming needle. This one is acupuncture plus moxibustion combined at the same time. So with the needle retained in the point, wrap the needle handle with a unit of moxa wool and ignite it to cause a mild heat sensation around the point. So it functions to warm the meridians and promote the free flow of qi and blood. So it treats the painful joints caused by cold, damp, numbness with cold sensation, and paralysis. So this is a picture of moxibustion with warming needling and then an actual video. So again, when you insert a acupuncture needle, usually for this kind of treatment, you tend to use a long needle, such as this one, a 2-inch needle or 2-2 needle. So they inserted it at roughly bladder 23. No? And then when she inserted the needle there, once you have the chi sensation, you would now place a paper to safeguard your warming needling. No? So this is just to cover the acupoint area and also for the ashes when it falls down, at least you have a paper layer to protect for your patient. No? Then you can get a moxa stick and cut it into smaller cones or smaller tubes. So usually the tubes is roughly the size of our thumb, roughly 1 inch. And then once you decided an adequate length of your moxa, moxa stick or your moxa tube, puncture it with a needle so that it can attach to your acupuncture needle at the acupoint that you just punctured. And then see, she put a hole inside the moxa stick so that it can, I don't know, so that it can be attached appropriately with the needle handle. And then you ignite it accordingly. No? So you can use a lighter, an incense, or even a cotton ball with flame on it to ignite your moxa. So some people will ignite from the top, other people will ignite from the bottom. Generally, when you ignite from the bottom, the patient tend to feel moxibustion faster versus the on the upper part, it will take time for the patient to feel the heat. So generally, the belief is the heat of the moxibustion can penetrate through the needle towards the acupoint to warm the specific areas below it or the specific Zangfu organs you want to treat. Okay? So this is an example of warming needling technique. Okay? So now let's go over to moxibustion and its health benefits. No? So studies have shown that moxa burnt over specific parts of the body can help in terms of activating immune functions, increasing the RBC, WBC count, enhance your lymphocyte and NK cell activity, heal wounded tissue, revive the organs which have lost their capacity to function optimally, as what you have seen a while ago on a case of neurogenic bladder with moxibustion with salt. It can also use to lower blood pressure, reduce blood viscosity, dilate various vessels. It can also be used to detoxify the body. Also used for chronic pain, immune system disorders and breakdown, autoimmune disorders. And also it can be used for lymphatic disorders requiring drainage, eyesight pain and blurriness, skin disorders, muscular tissue tension, injuries, blockages, slip disc, strained or injured ligaments and tendons, arthritis or rheumatism attack of the muscle and the joints, carpal tunnel, tendonitis, nerve joint inflammation, repetitive strain injuries, acute gastroenteritis, peptic ulcer, diarrhea, indigestion, low metabolism, food poisoning, asthma, liver and spleen, pancreatic weakness, kidney and gallbladder stones, but basically to boost the function of the kidney and your other Zangfu organs. Nowadays, fertility boost. Most people that has problems with fertility, moxibustion is a very, very good treatment modality for fertility. So for the ladies also, menstrual cramps, disorders, chronic pelvic inflammation, and even menopausal issues, prostate issues, and heart weakness. So as you can see, the effect of moxibustion is very holistic and very systemic. So it can be used to address all this issue with the core principle of regulating your body's foundation of immunity, or in TCM, warming the yang qi so as to help perform your bodily functions. Okay, so let's now go over to the key points in moxibustion. So the Precious Prescription points out that moxibustion generally applied to yang portions first, then to the yin portion, then it's applied to the upper part first, and then to the lower part. This is just a guide, huh? Okay, but generally the old school guide in the ancient classics. Treat the back first and then the abdominal region second, the head and the body first, and the four extremities second. So the trunk, no, before the extremities. And then you should also remember, sequence should be given according to the pathological condition or based on your TCM diagnosis. So it also notes there that the volume for Moxa, including the size of the Moxa cone or duration of the Moxa stick application, should be in parallel to the patient's pathological conditions, constitution, age, and the site where moxibustion is to be applied. A general guide, usually for when you're going to use Moxa cones, regardless of the size, it's between 3 to 7 cones. And then for a Moxa stick, a single Moxa stick, you can apply it for 10 to 15 minutes on it. No? Okay, so this is just a general guide. However, it still boils down to the assessment of the practitioner per se, your personal assessment for the client. So this is just a guide by the ancient classics. So now let's go over to contraindications for moxibustion. Technically, moxa is contraindicated for excess and heat syndrome. That includes high fever due to common cold or heat due to yin deficiency are not allowed to be treated by moxibustion. However, nowadays, I have seen based on research that even moxa, you can use it even for excess syndrome and heat syndrome. Because remember, an ancient saying by the Chinese physician, you use the toxin to remove the toxin and you use heat to reduce heat. An example of using toxin to remove toxin, no? When you do a garlic moxibustion for insect stings or even ginger moxa for insect stings or poison bites. Remember, your insect stings and poison bites have toxin in it. So you're going to use the toxin in the garlic to dispel the toxin for the insect sting or poison bites. Another, take a look. You can use heat to reduce heat. So it seems paradoxical at first, no? It seems contradictory, but it has actually a paradoxical effect. So an example for this one is your furuncles, carbuncles, or even your pimples, no? I remember before I had a patient with multiple bacne or acne on the back. I use Moxa on it. And then the following day, the size of the acne on the back has reduced considerably. So you would think that, doc, acne is heat. Then you use Moxa as heat. That's contraindicated. But if you take a look at it, if you analyze it, no, even the ancient Chinese physicians can say to you that when you use heat, you can also use the heat to reduce the heat. So one example of that is the Bacne case of a personal case of mine. Another is herpes zoster or your shingles. Remember, herpes zoster is damp heat attacking the gallbladder meridian. So they are heat toxins per se. You can use Moxa to dispel these heat toxins, specifically your vesicles in the shingles, no? So these are toxins, viral toxins. You can use Moxa to dispel it to dispel these toxins. And you can also use Moxa to boost their immunity so as to counteract their condition of shingles. So these are examples of this seems contradictory but paradoxical effect of moxibustion. Okay? So again, generally in your pulse diagnosis, people who have feeble and rapid pulse indicates heat syndromes. Technically speaking, on the book, they always say it's contraindicated. But nowadays, we challenge that belief. Scarring moxa definitely should not be applied to the face or the head or in the area of the large blood vessels. For example, you do not apply scarring moxa at bladder 1, which is near the eye, and stomach 9, which is near your carotid artery or your carotid vessels. No? But you can apply indirect moxa via Moxa Stick as well. Just not scarring. Do not apply scarring moxa at bladder 1, stomach 9. Okay? What about pregnancy? Generally, they're not allowed to use moxa on the abdominal or lumbosacral region of a pregnant woman. Other areas, are they allowed? Yep, they are allowed for other areas. So after moxa, you have different degrees of burns that may remain in the local region. Normally, there is only a slight red sign of burning, which will disappear very soon. No? And then sometimes few blisters result on the skin surface, and we have small blisters, large, and blisters with pus. Generally, like ventosa or your dry cupping, small blisters, we don't break them. We just let it be. It will heal spontaneously. Large blisters, you can puncture them and drain it. Just remember to dress them appropriately and do your standard disinfection procedures. Blisters with pus, dress to prevent further infection, coupled together with TCM herbs or Western medicine for control of infection. So for moxibustion, let's delve more into equipments. So we can have, as you can see nowadays, they use multiple. No, we have moxibustion stick holder like this one, multiple. There's also a moxibustion hammer where you can put your moxa stick, and you can have it, place it very self-care, self-explanatory. Then there's also the Moxibustion tools such as this, like an incense, where you place your Moxa stick there and do accordingly. However, I want to warn you, I don't use this much because these are all metals. Remember, your metals conduct heat faster, stronger, twice, no? So when that metal touches the skin, you are more likely to get burn injuries. That's why for me, I don't like to use much Moxibustion accessories. I just go with the old school Moxibustion, no? Old school Moxa, very simple, just your hand and your Moxa stick, that's it. But other people, they use a moxa pouch like this that can be placed in the umbilicus with your a certain size of your moxa stick. It's roughly like a tube, no? Then you place it at the umbilicus or even the neck area with a strap. So this one is very self-explanatory. But remember, your hot metal, be careful with them because they conduct heat stronger. So even a slight touch to them, you will get burn injuries. Then also another version. Then also we have Moxibustion box. For me, I tend to use Moxibustion box more because this is very self-doable, very easy to use. No, other version. You have Moxa stick on it. You have an exhaust on it. You don't need a practitioner. You can monitor, or you can just come back once the patient, does it himself or herself. Other people, they use a adhesive moxa nowadays. So you can use it more for the back points and also for sticking it on specific acupuncture points. Also, they tend to use a smokeless moxa nowadays. Most people tend to practice smokeless moxa nowadays because the smoke is also a problem, no, for our TCM practitioners. Other people, they get creative. They make moxibustion via glasses so as to help the eyes, strengthen the eyes, no, for eyesight problems and vision, no. Okay, so I think that ends for our Moxibustion lecture for now. I hope you guys learned something, and thank you for showing interest in attending my Moxibustion lecture for the day. So once again, I would like to thank each and every one of you for attending for our webinar for today, specifically Moxibustion. Thank you for your attention. Thank you.